Heart failure. It is a condition where the heart fails to pump enough blood to meet the metabolic demands of the body. There is a decrease in force of contraction and cardiac output. Two compensating mechanisms come into action now. First is sympathetic stimulation. It causes vasoconstriction, which in turn increases preload and afterload. Via B1 receptor stimulation, force of contraction and heart rate are also increased. The second one is renin-angiotensin-aldosterone mechanism. It causes sodium and water retention. These mechanisms initially improve the condition, but on the long run worsen it. Now the drugs used in heart failure. First choice of drugs are diuretics. The main diuretics used are loop diuretics. Apart from that, thiazide diuretics and spironolactone, which is a potassium-sparing diuretic, and aldosterone antagonist is also used. Then we use angiotensin-converting enzyme inhibitors, angiotensin receptor blockers, beta blockers, vasodilators, and ionotropic drugs. These are drugs which cause increase in cardiac contractility. The mechanism of action of digoxin. Digoxin reversibly inhibits sodium-potassium ATPase. This increases intracellular sodium levels, which in turn increases the calcium levels in the cell. This causes increase in force of contraction. Major effects of digoxin. The cardiac effects include increase in force of contraction and cardiac output, decrease in heart rate, increased refractory period, and decrease in conduction velocity in AV node. In the ECG, changes include increased PR interval, shortened QT interval, and flattened or inversion of T wave. In the kidney, there is increased renal perfusion. Retained salt and water is gradually excreted. In CNS, it manifests as nausea and vomiting. Then digoxin adverse effect. Digoxin has a narrow therapeutic margin and can easily cause toxicity. The manifestations include visual changes such as blurring of vision and photophobia, gastrointestinal effects like anorexia, nausea, and vomiting, cardiac effects like bradycardia, extrasystoles, AV blocks, and apart from that, gynecomastia in males and skin rashes. Treatment of digoxin toxicity. Immediately insert temporary cardiac pacemakers and administer digitalis antibodies. These are useful not only for digoxin but most of the other glycosides as well. Apart from that, potassium supplementation is given via oral or parenteral route. Now approach to the patient with heart failure. How do we examine heart failure? We calculate the ejection fraction. If less than 40%, we check for signs and symptoms or fluid retention. If present, we give diuretics. If absent, we give ACE inhibitors, beta blockers, and digoxin. Now